With this panel discussion, we want this to be very interactive, so each panelist is going to present about 5 minutes of their experience with disease prevention or diabetes prevention, and then we're going to open it up to questions. So we will have the Public Health Department with a microphone that will be able to come in and bring the microphone to you to ask the questions to the panel. But again, we'd like to make this as interactive as possible, so any questions that you have, if you're not comfortable asking the question, you can whisper it in my ear because I'm not shy and I'll ask the question for you. So we have Dr. Mike Fistek, he's internal medicine with the Cleveland Clinic. I have Dr. Lydia Cook, president from Summa Health Medical Group. John Dimmick, he's a pharmacist with Ritzman Pharmacies, the Associate Director of Central Services. And then Malcolm Moore, he's a program ambassador for diabetes prevention. So, did someone drop this?
Yes.
Okay. Jacqueline Green dropped an ID badge. Jacqueline Green from Summa. Okay, I'm going to find you in a minute. Okay, so I'm going to go ahead and turn it over to the panel. Why don't we start with since you're on the end here, you can go ahead and start with yours. Again, if you just want to give a 5-minute presentation about your experiences with diabetes prevention, and then we will kind of move along the table and then open it up to questions. Okay, thank you.
Good morning, everyone. I am here this morning to talk about diabetes prevention. And I have a very good story and relationship with the YMCA diabetes prevention program, and also Summa Health has a Sweet Life diabetes prevention program. We know that the CDC had identified about 86 million persons with risk for diabetes, and they are considered a pre-diabetes. Is kind of identified by glucose testing or blood sugar testing, and also weight-related. And so when you are really looking at that huge of a population and talking about prevention, you want to really have a program that is really kind of customized and focused and has been successful. Now, diabetes prevention program with the YMCA was a program that was very well studied, and the initial study showed about 58% prevention for people that were in a pre-diabetes state, really then going on to diabetes. And over a 10-year period of time, it was about 38% prevention with the diabetes prevention program that the Y presents. We are at Summa Health very strongly focused on population health and really have a journey to be a population health organization and do what we call value-based care. And the focus is the triple aim, which is lowering the cost of care, having a great patient experience, and having a better health outcome. As part of that, medicine used to be episodic care, just one-on-one, face-to-face. Whoever you see in the office, that's who you take care of. And now with population health focus, it's about looking at the population of patients that you care for and then identifying those that are in the well space, in the rising risk space, have chronic disease, have high acuity illness, and then kind of customizing the care every step of the way. And so we want to focus on the rising risk population and really prevent them from going into that chronic disease space. And so you say, what kind of programs we can deploy or support in taking care of that population that will help that rising risk population and prevent them from going into that chronic disease space. And so that's where I'm really supportive of the diabetes prevention program. I was with another organization, and we worked with the Y very closely and partnered with them, and we saw 2 barriers to implementing a program. It was one, cost, and you'll hear that quite a bit probably from the rest of the panelists, and 2, a time commitment, adherence to the longevity of the program. Because we know that there's been many studies that in order to form a good habit, there's a certain time frame that you have to really take on before you can say, I'm hardwired, and that habit is instilled and it'll go on, for a lifetime. So those were the two barriers that we saw in my experience with diabetes prevention. So one of the programs that we have at Summa Health at our Health Equity Center is Sweet Life, and that program is a free program, so that's the benefit to take away the barrier for costs. The other way we did to take away the barrier for the YMCA program is we worked with some payers, and the payers incorporated those as part of their wellness program, or also put it as a rider that it would be covered under the insurance. So those are some techniques or abilities. So those of you who have wellness programs or thinking about incorporating these kind of programs in your wellness program, those are the things that you want to think about. Can you get the payers to see the worth and the value proposition to payers are that you'll decrease the cost of care because you'll prevent that rising risk to going into the chronic disease space. So the other thing was the time adherence. So there's been quite a bit of studies, and diabetes prevention program is a year-long program, but there have been studies within the cohort of that program that if you do the initial 16 weeks, or at least at the very least stay with the 9 weeks, that you did see some good signs of slowing that movement from pre-diabetes to diabetes. So there is going to be a study coming out from a group in Cleveland that recently really worked together with the YMCA to show some of those good outcomes. So that's been my experience. I don't want to take up too much time, so I want to give the other panelists opportunity, but just think population health and the various stratifiers of what the population looks like, and then how you take care of them. And also think about lifestyle. Lifestyle. What we do in medicine is maybe like 10% of impact to a patient. And that face-to-face experience is just a small portion of what we do. That's why we talk about patient-centered medical homes as well as population health. And population health includes a whole team of people, and all of the teams sitting at the table, some of the representatives of that team are sitting here at the table that support patient care as a whole.
Hello, my name is Malcolm Moore. I'm a participant of the YMCA Preventative Diabetes Program. The program, I was introduced by Dr. Fistick, visited his office, and he actually told me that I was pre-diabetic, and that what impressed me the most about him is the time that he took not only to explain the program, but he, just discussed changing eating habits, focusing not so much on diet, but, your lifestyle, what you're eating. So following that, he told me about the program. I guess the biggest caution I had was the year commitment. And then once I got over that hurdle, we had an orientation with Lisa, and she told us it was 16 weeks, every once a week for 16 weeks. Then after that, you attended every other week for a total of 8 weeks, and then once a month for a total of 6 months. So your goal in participating in the program is to reduce your body weight by 7% and to increase your physical activity up to a minimum of 150 minutes per week. So that part is primarily what they focus on during the class. And so we start out discussing on ways on how to curb your diet, healthy eating, portion sizes. And in the one video that they showed, the gentleman said, you can have a steak, and that steak could be your meal for the day. Well, it's actually true, because with the program, you focus on fat grams, and you also focus on calories. I focus mainly for myself. I find it more successful to focus on the fat grams. So my fat grams, based on my weight at the time, and still based on my weight, was 55, maximum of 55 fat grams per day. Well, a strip steak, a New York strip, which I love, is 55 grams per day. So, you can either like go the whole day and have the steak in the evening, or or whatever. But then you start to discuss other things, like with the baked potato, opposed to having all the toppings on the baked potato, some alternatives to that. I thought when I was trying to lose weight that eating nuts, everyone said eat nuts is healthy, However, nuts are high in fat grams. So if your goal is to have fat grams, even chips, and I'll be quick, but potato chips, which I love, potato chips, there's 11 grams of fat, 160 calories per 1 ounce of potato chips. And these are the things that you start to learn. And, I even have a scale. I remember the first class, Lisa had portion sizes and she had scales. And I'm like, this is not for me. I am not going to, I didn't envision myself weighing my food, and I was like, oh boy, so. But actually, I found myself, and I'm not saying I don't eat chips, but maybe I'll weigh out an ounce of chips instead of eating the whole bag of chips. And I'm not talking about the 99-cent bag. I'm talking about the $5 bag. But anyway, so you learn those type of things, different fruits that are good for you. Fruits are normally. And, my other weakness is Coca-Cola. I'm a Coca-holic. However, Coke, and then I said, well, this is good because it's 0 fat grams. I can have all the Coke I want. Coca-Cola, that is. I can have all the Coca-Cola I want. So then, but however, you have to kind of control that too, because then you start to get into the sugar and everything else. But I found the program very worthwhile. I think I lost around 45 pounds during the program. Thank you. Trying to keep from gaining 40 back, but no, I did pick up 5, but I had surgery in March that kind of hampered my exercise. I increased my weight, and then once you get off the routine, it's kind of hard. It's easy to stay off, and it's harder to get yourself back on. But you eventually get back on the program, and I'm still at 40 pounds, and I'm working to get. My goal actually was to lose 60, so. That's still my goal to lose the 60 pounds. Thank you.
Hello everyone, my name is John Dimmick. I'm a pharmacist with Ritzman Pharmacies. We are a small retail chain. We have about 21 pharmacies in the greater Akron area, and we've partnered with the YMCA to kind of help act as a referral source to the program. So we don't have a hand specifically in the actual class and program that takes place, but we help screen and identify patients in the community that would benefit most from it, and then we provide screening opportunities for them to try to funnel them into the program. So our main roles as pharmacists are to oversee medication therapy, but a lot of the times it's best to actually preempt medication therapy. Rather than just let everyone get to diabetes, as we've been talking about all morning, it's best to hit that lower part of the iceberg and take care of it ahead of time before they need things like metformin and all these other anti-diabetic drugs. And a lot of the times the lifestyle modifications work better than medicine. So most of a pharmacist's role, while it is to oversee medication therapy in patients, it's also to determine when it's most appropriate to give someone medicine. And if we could ever prevent someone from taking medicine, then we're definitely going to pursue that option as well. So the YMCA's diabetes prevention program works very well into Ritzman Pharmacy's promise to the community to provide care beyond the prescription. So we want to do more than just provide prescription medicine to our communities. We want to help actually improve health outcomes of our patients and our community members. So a pharmacist is in a unique position where we can see a patient a lot of the times more often than their physician can at their physician's office. They're most commonly coming into the pharmacy at least once a month, sometimes more than that. They build long-standing relationships with their pharmacists, and we usually have a pretty good idea of what's going on in that person's life and where they're at in their health journey throughout their life. So it's very easy to identify those who would be at risk for prediabetes from a pharmacist's perspective. Definitely based on the risk criteria that are outlined in the questionnaire you all saw earlier, but also based on someone's medication profile and the types of medicines they're on, provide us clinical clues to see what's going on in someone's medical history, and also we can help identify certain medications that can predispose or put people at risk for developing diabetes. So the way that our program works in tandem with the YMCA is when one of our pharmacists finds someone that is probably at risk for prediabetes or to be pre-diabetic, they try to get them involved with this program, and we will offer that person an A1C blood test, which is kind of the gold standard for diagnosis of prediabetes, or at least from a screening perspective. So what we will do is take patients and customers that meet all of these risk criteria, pull them aside the next time they're in the pharmacy to see if they want to have a conversation with their pharmacist. Hey, have you meet certain criteria that may put you at risk for developing diabetes later in life? Have you ever talked to your doctor about diabetes? Most of the time they have already, but we'll describe this program to them, explain that it's a year commitment, that there's a cost involved, but then really show them the benefit that they might get from it. And if someone's interested in it, the Ritzman pharmacist will then provide that person with an A1C test right there in the pharmacy. Only takes a finger stick, a draw of a little bit of blood, and a few minutes. And then if their number falls within the range of 5.7 to 6.4%, which is the cutoff for being pre-diabetic, then they would automatically qualify for the YMCA's program, and then we would send their referral to Karen at the YMCA for them to hopefully get into it and pursue the entire year and improve their health. And then if a lot of the times we will find people who are beyond prediabetes and are actually just diabetic, in which case we refer them to their physician for follow-up as well. That's most of our involvement with it, is to try to obtain referrals from the community and to help use our power as pharmacists to identify those who are most at risk in our communities for prediabetes and later diabetes in their life.
Good morning, everyone. So I'm Dr. Fistek, and I actually like going last here because pretty much everyone touched a lot of the points I was going to discuss. So I'm going to be probably a little bit briefer than everyone else. Thank you, Malcolm, for your kind words. You know, Malcolm's a prime example of somebody that unfortunately I don't see too often in the office, somebody that's willing and ready to make a change in their life for the better. And luckily he was. And as you see, you know, he's down 40 pounds. He's making some really good headway in his life, and he's prevented diabetes. That's the whole goal. You know, he's prevented himself from diving into diabetes and all that entails. So congratulations to him again. You know, my goal as a physician is to try to find people that are at risk for diabetes and get them the proper support that they need. Up until I met Larry and Lisa, this was probably a year and a half ago now, there really wasn't much in the community that we could use to help people. And unfortunately, you know, as physicians, we don't have a ton of time to sit there and talk to people about health and wellness. We just don't. You know, we're too busy discussing their medications and making sure, you know, we're doing the right dosing and everything else. So when they came to me a year and a half ago and they presented their program, I was interested, but I'm not the kind of physician that just jumps into things easily. I need to have some background data, I need to have some evidence. And luckily, they were able to provide me with that. And that's one of the best things about this program. It's evidence-based medicine, which is very, very key for me. And we kind of run through it a little bit here. But there was significant study actually in the New England Journal of Medicine back in 2002. This study came out, and the YMCA basically took that study and developed a program based on it. So to me, that's a great start. Took me a while to buy in completely, as they can probably tell you. I did a lot of research into the program. I actually took the manual home with me and read up on it. But I liked what I saw, and so I started sending people there, and obviously, we've got some good outcomes. So just to kind of finish up what we discussed, I just wanted to touch on a couple points here that I think are kind of shocking. In Summit County, when I was doing research on this, back in 2010, which is the last time we had this data, we have about 420,000 people in Summit County. And the number of people with prediabetes is almost 150,000. Okay, that's 35% of our population. If you add the people with diabetes itself, that's about 50,000, you're up to almost 50% of the population that has either prediabetes or diabetes. So obviously this is a huge issue in our community. So it's something that we have to focus on, something that we have to pay attention to. And for employers especially, everything's about costs. What it's going to cost to enroll people in this program versus what you're going to get back. And, in my opinion, it's a good program. It's got evidence behind it. It does a great job. And you're going to see some significant benefit when these employees are enrolled in this program. That's pretty much about it. If you guys have any questions, I guess we can open it up for questions.
Yeah, thank you very much. So we'll open it up for questions now. Jeff from the Public Health Department is going to walk around with a microphone. So if you just want to raise your hand, he can bring the microphone over to you. Does anybody, when you ask your question, up here in the front here, Jeff, if you can say the name of who you're addressing, the panelists that you were addressing the question to, that you would like to respond, or if you want all of them to respond, and that would help out as far as the panelists.
Thank you for your presentations. Malcolm, I'm always interested in the tipping point, or the point where you say, I'm ready to do this, because it probably wasn't a big surprise that you needed to do something about your health. So what made what the doctor said impact you enough to do the program? And when you got in there and saw the scales and the food and said, oh my gosh, this isn't for me, what made you not walk away?
You're right. It wasn't the first time. Actually, Dr. Fistic is a partner of my regular physician who was unavailable at the time, and so he filled in. And my regular physician, I think, had maybe touched on the fact that I was pre-diabetic, but it didn't sink in. Dr. Fistic, like I said, he wasn't forceful with it, but he put information, went and brought, I think he brought some literature out, and he said, you don't have to lose, 50 pounds in 1 month. Focus on losing, a pound a week. So he did that, and then there was some time, surprisingly, with the numbers that he gave, there was a time between when I was introduced to the program from him and when the program actually started, because of the available number of, you had to have a certain class size, so the available participants. So once we had enough people in the class, I think it was maybe 2 months, maybe 2 months after that. And then, so when I did go to the class, I mean, I was ready. He had given me some suggestions that I started following. And then the class, I guess, you know, the first week, and then you interact with the other people in the class. And then there's another gentleman in the class. He and I kind of had, we were the only two males. He and I had a little competition thing going, I guess. And so, you know, it's very private. You don't have to, you know, you don't share your information, your weight information or anything like that. But he and I would, you know, I lost, you know, 2 pounds this week. Well, I lost 3 pounds, you know, something like that. And we would share in the class, you would share different ideas for, you know, like a sweet potato instead of butter. He said, well, he puts hot sauce on a sweet potato. And then he says, try it, it's really good. I haven't tried it yet. I'm sorry. But I don't know. I guess I was just, you know, it's the Lord's will. It was just time for it to happen. It was, you know, a great time. The reason I went to the doctor, though, is I had a dizzy spell. And I was at a wedding. And I was like, oh, Lord, don't let me pass out at these people's wedding. And then they have to, you know, blow their ceremony or whatever. I guess that experience along with what he said and, you know, just the culmination of everything together. I promise not to talk so much.
Thank you. My name is Edna Borders, and I'm with the county. I do not have any question, but I have testimony. And I have to have this testimony because of my friend Russ. Russ and I always fight about being pre-diabetic. I'm a number 2. And I was weighing 255 pounds. I'm down to 49 pounds as of last week when I went to the doctor. But let me tell you, it's not losing the weight that it was important. I make sure I go to the foot doctor. Me and the foot doctor has it out all the time. I would tell my boss, I went to the foot doctor, get there at 4 o'clock. She doesn't see me till 6:30. I'm about having a fit. I said, you know, it's not that, you know, I need to leave, but I know how important for me to be able to walk. I go to the dentist like I'm supposed to. When I went to the dentist last week, she said, oh, your teeth is great. I don't have no false teeth. So I follow the rules. Also, the other thing, when I went to the eye doctor, where people wearing glasses, I'm just reading readers because my eyesight is great. Let me tell you, when I go and eat, I go out to eat and I eat a lot because I've been going out with Eileen a lot. We go to breakfast. I cut it in half. I take the other half for the next day. When I go to dinner, I cut half. I watch what I eat. Sometimes I don't eat everything. My Fitbit, let me tell you, I wear it all the time. I'll be walking somewhere, I'll be sitting somewhere, and it's like, ooh, it shakes me because I did my 10,000 steps. I'm not ready for it. You know, it's little things you could do that can make a difference. And those are the little things I'm going to do. Next year, I'm going to be 70 years old, and I don't tell this too often. But I am living, and I'm feeling great because I told Russ, I want to live. I want to make a change. And that's what I'm trying to do. So, you know, it's going to the doctor. And your pharmacy, I have to tell you, my doctor loves to give me medicine, little samples. I go to her and I said, I don't know about this medicine. Let me read about it, you know, and I checked with the pharmacy. He said, it might make your feet swell. No, I go back and tell her I'm not taking this pill. All I need to have my feet swelling because I'm trying to take a pill to lower my things. My number was a 12. I'm down to a 9. But I'm going to say that, you know, diabetes, especially with Afro-American, it is very, very important. It's taking us away. We need to do something. So you just need to make sure that you just find out what's out there do it. Don't have to, you just have to. I don't know how to express it. I got so many friends that just leaving, going by side. We want to live where our community lives, so please, take it seriously. And that's my testimony.
For Dr. Mike, could you repeat those statistics about Summit County? I mentioned some statistics in my report. That was based on Summit, Medina, and Portage County. That's the YMCA service area. And our service area, Summit, Medina, and Portage, was 66,000 folks already with type 2 diabetes, and then the pre-diabetic population is 240,000. But Dr. Mike, repeat that, because I was kind of blown away by the numbers that you came up with just for Summit County. And my numbers probably go back about 3 years. So you've got data from last 2 years ago?
No, this was 2010 was the last I could pull. But I did this research about 6 months ago, so we might have more updated data. But 2010, I mean, I don't think we've gotten better in controlling prediabetes and diabetes since then. So the adult population in Summit County was 422,000. The number with prediabetes was 147,000, which is about 35%. And the number with actual type 2 diabetes was 44,000. So if you throw all those numbers together, you're at about 46% with diabetes or prediabetes. The majority of that being prediabetes. So, 3 times more pre-diabetics in the region than there are diabetics. So think about how many potential people we could help with prediabetes, prevent them from getting into that diabetic category.
So I have a question for Dr. Fistic and Dr. Cook. Most of the time when you go to the doctor, and I've experienced it personally myself, and then also just with being a benefits manager and seeing the utilization of medications on our health plan, even with mental health, you go into the doctor and like you say that you don't really have a lot of time to spend with that patient. And so what I find and see is a lot of push of just, well, here, take this pill. Take this pill to lower your blood pressure. Take this pill to lower your cholesterol. And do these things. And again, that would help prevent with the diabetes. But in lieu of that, what would you say providers could be doing, or what could we as employers or in the community be doing to encourage physicians to promote more of a healthy lifestyle, actions like the YMCA diabetes prevention program versus pushing medications? Nothing against the pharmacist up here, but and how can we tackle that issue? Because I think it's an issue.
That's a great question. I think it's most physicians' goal to talk about diet and lifestyle changes first with most conditions, diabetes, hypertension, high cholesterol. It's our goal to bring it up first. I typically give people 3 to 6 months to make a change, especially if their numbers are really not looking good, and then I'm kind of concerned about them going too long. So you discuss it, you bring it up with as much time as you have, and then you kind of leave it in the patient's hands. But I'll be honest with you, it's to her point, patients have to be ready to make a change. And I can talk, and I've talked to them blue in the face, the patients, about making changes, and they just don't get it. They don't understand, how important it is to make those changes. Luckily, in Malcolm's case, he figured it out. He realized, hey, I got to make a change right now, otherwise this is going to end badly. So going back to your question, it's very difficult, and I don't think we do a good job in this area of having extra support. Physicians, they just don't. You can't send somebody to a health and wellness program because there really aren't that many in the area that exist. There are some, but in my opinion, they really don't do a good job. They don't have good outcomes data. This program is nice because I think an important thing is people have to understand the issue, they have to come up with a plan, and then they have to stick to that plan. That's the key. And if you frequently monitor them, if you bring them back once a week for 16 weeks and then once a week for 2 months, they're constantly talking about it, they're constantly thinking about it, which is what they need to do. They leave my office, I don't see them for 3 months. sure, that first couple of days, they're like, I really, what he said really seemed to make sense to me, and I should make a change. But then, the further out you get, it just goes to the wayside. Yeah. So, I think we still have, obviously have work to do, but this is a good step. This is definitely something in the community that I think we can utilize, and it works. I mean, we've got good data on it.
Thank you.
So thank you for the question, because it's really a very important question. So that's really what population health and centering is all about, and understanding that the physician can't do it all. And so when you're putting together a care team, like I was not joking when I said all the elements are here except for a medical assistant and a nursing staff and a case manager and a social worker. All of those elements, and even extending your arm out into the community with community resources like the YMCA's diabetes prevention program. So what we are really trying to envision is to organize our care delivery in a way that everybody works at the top of their license. And so when the doctor sees a patient, they're seeing the individual that has already really been diagnosed and is in the chronic disease space. And so the doctor's supporting how we medically manage that individual. But those individuals that are in the wellness and prevention space or the rising risk space probably would be better suited to be working with our medical assistants, our case managers, our RN care managers, our licensed psychiatric social workers for any kind of mental health disease, and our community health workers, who we can really kind of train to outreach into the neighborhood and in the community, as well as patient navigators who are lay people who really individuals can relate to. You're part and parcel of the community, and you're working together to identify what are kinds of things that we could do together. Malcolm just said that him and the other individual in the program had a little competition. They talked through, what was happening with their weight and how they were working and what they were eating. That's the kinds of things that happen in your everyday work environment or home environment. And so the doctor can't really be in that space. So we are trained as physicians to solve a problem and fix that problem. And so when you come in, we say, okay, you have a problem, and so we have this array of treatments that we can offer you. And so that helps us feel like we really saved a life. I'm always joking because I'm an administrator now, and I used to see patients once a week, so I would tell my administrative partners, I'm leaving because I'm going to go save some lives. And so that's really the kind of thinking that we have as physicians, and we need our team around us to really support the patient with other alternatives, because lifestyle, remember what I said before, what the doctor does is only 10%, so medication is only a small portion of what can help you. Lifestyle change is about 60% of what can make an impact. And so the tipping point question was a key question, is how do we motivate? And Dr. Fistak talked about how do we get a patient motivated around that? And it can't be just the doctor. The doctor plays a real good role, especially if they have a good relationship, and they can give a prescription for the diabetes program, but then we need other people around us to support that individual to really get to the diabetes program. So that, I think, it's more as a team.
Okay, great, appreciate it.
Hi, I had a question. Just on curiosity, based on the presence you have in SUMA and the Cleveland Clinic in the Akron area, how many more physicians are on board? I know it's kind of going across from what you just mentioned, but I would assume that many more physicians are on board at SUMA. And what have you done, Dr. Mike, to really empower your colleagues to promote this program and get more people referred and more people on board?
You could just yell. Yeah, so it's tough. I think physicians like evidence-based medicine, and we are inundated with reps, with medications, with programs that come to our office. It's a constant thing. So how do you get a physician on board with a program like this, and it's not easy to do. You know, we've had many discussions about it because, I'll be honest with you, not a lot of physicians are using the program. Why is that? I think it's just because they don't have the data. You know, they don't have the ability to look at it and say, you know what, this is evidence-based. Look at these outcomes. This is a really good idea. And you know, we're going to work on that, trying to get it out to the physicians, you know, face to face. Otherwise, they're not going to hear about it, they're not going to know about it, and they're not going to be able to utilize it.
Good morning. I'm 100% into the whole wellness initiative. As an employer, though, and particularly as an employer for a nonprofit, my issue is funding. I think part of the big problem with the whole wellness initiative is back to, unfortunately, cost. I mean, simple things. Who is it? Whole Foods. That's the healthy place to go. Have you seen the prices there? You got to pay more to be healthy. So I think when you have the whole wellness discussion, I think that the medical community, as well as employers, need to focus more on funding. Because the programs themselves, like the DPP, excellent program. I could probably push that through my organization, but again, it's going to come back to my ability to fund some of this. And I think as an employer, that's what I need to see is more funding opportunities without having to write a dissertation to get the money.
I would like to jump in and offer a couple tidbits of advice, I guess, some nuggets of information. There are some resources that I know and I can share that are for free in the community. I know the Public Health Department has some resources available, and they have some grant money that's available to do some wellness programming. They've been helping with funding some of the costs of the YMCA diabetes prevention program based on a participant's income, so that's a resource there. The Sweet Life with SUMA is a free program for pre-diabetes. It's something we've actually promoted within our within Summit County's population, and when we've done that program, we've had 30 to 40 employees who have attended it, and it's, I forget how long, is it 15 weeks? 15. And they go to, the feedback that we got was just phenomenal. So again, that was a free resource, and we had the employees committed to that. We promote Metro Parks hikes, and so even just to do a raffle for Fitbit or something like that, if they participate in so many hikes. We fortunately are blessed that we have wellness dollars from our medical carrier. That's something I negotiate very hard and strong with them every year to make sure that we continue to get those dollars. So that's a resource as well. But there are resources available from your health insurance carrier that, you know, a lot of those reps that are coming out to meet with you as an employer, you know, they're looking at your renewal numbers, service issues, claim issues, and really there are resources there. You just need to push them to say, what can we do to bring a program out here and have them assist you with that. So those are just some resources that I know of just off the top of my head, winging it here. But if you would like to call me, I'd be happy to talk with you about some of the other things that we do at Summit County for our employees that we've been able to do on a budget, basically, without wellness dollars.
Mr. Ford, the YMCA is a charity in our community. Each year we have an annual campaign that we raise dollars from our members to support programs like the YMCA Diabetes Prevention Program, as well as to provide memberships for low-income individuals. Thanks to Summit County, we do have funding from ODH, as was mentioned, the stipend program. And then also SUMA Health has made a commitment through the foundation to give charitable dollars so that we can provide the program for individuals that need that kind of support.
Good morning. This is just a follow-up on Wendy's in regards to the health insurance carrier. If you have not asked your health insurance carrier for dollars through incentive program, currently the City of Cabo Falls, we use Medical Mutual of Ohio, and the funds that they're bringing to our wellness committee and our wellness program $10,000 to $15,000 to put into our wellness funds. Now, I don't know if that's a secret, but you know, we're a public employer, so anyone can go out and get that information if they wanted it. But it's very important if you are covered by medical mutual. I don't know about United Healthcare or the other carriers, but we use those funds for our health fair. The things that we purchase for the health fair in regards to incentives. We do monthly events. We also use a program called Vitality program. I think Summit County uses the same program, and we tie that in with our incentives. So we have funds available to get employees to use the Vitality program and gain points so that they can reduce their out-of-pocket costs on their health insurance. The other thing that I wanted to ask, and I believe it's Lisa, you had mentioned something about a CPT code that you have gotten. Is that something that we could provide to our health insurance carrier to see if our plan, for those that may not be self-insured and are fully insured, to see if it's covered under the health insurance plan that we currently have?
That will be in effect in 2017, so
Okay.
the answer will be yes.
Okay,
Yeah.
great, thank you.